Now, please join me in the welcoming Yasaman Aliyan from Iran. Her presentation is titled Pharmaceutical Strategies for Targeting Genetic Mutation in Cancer, Challenges and Opportunities.
Review titled Pharmaceutical Strategies for Targeting Genetic Mutations in Cancer, Challenges and Opportunities. In this review, I'll walk you through the landscape of precision cancer therapies, some of their major breakthroughs, but also roadblocks that we still face, and the exciting innovations on the horizon. Well, why targeted genetic mutation in cancer matters? Cancer is fundamentally a genetic disease. It's driven by mutations that disrupt normal cellular processes. Unlike traditional chemotherapy, which affects both healthy and cancerous cells, targeted therapy are designed to block specific molecules that drive tumor growth. These approaches are central to precision medicine, and their development has significantly changed how we treat cancer nowadays. In this review, I aimed to assess the major pharmaceutical strategies used to target genetic mutations. I conducted a literature review focusing on small molecule inhibitors and monoclonal antibodies, RNA-based therapies, and emerging gene editing techniques. I also reviewed real-world studies and evaluate the clinical and regulatory challenges that limit these therapies. With the two most well-established classes of targeted therapy. One of them is small molecule inhibitors, and the other one is monoclonal antibodies. Small molecule inhibitors enter the cell and block signal proteins. For example, kinase inhibitors that interfere with pathways like BRAF or EGFR. And monoclonal antibodies, on the other hand, work outside the cell. They bind to the surface proteins like HER2, and their function is to block these proteins or to recruit immune systems to attack the tumor. Both of these strategies shown success, but each comes with limitations like resistance or delivery challenges. More recent innovations involve RNA-based therapies and gene editing. siRNA and mRNA platforms allow us to silence oncogene to stimulate immune responses, as we've seen with mRNA vaccines. And gene editing technologies like CRISPR-Cas9 offer the possibility to correct mutations at the DNA level. However, these techniques are still in early phase trials and face challenges related to delivery, safety, and ethical approval. Despite the challenges, some therapies have shown remarkably successful. Success. For example, imatinib, it's revolutionized the treatment of chronic myeloid leukemia by targeting the BCR-ABL fusion gene. Similarly, EGFR inhibitors have shown a significant benefit in lung cancer patients with EGFR mutations, These examples that we've said show the targeting mutation, showed that targeting mutation has extended survival nowadays. However, there are still some major hurdles. First of all, we have resistance, which is a very big problem nowadays because cancer cells evolve to bypass the drug's effect. Second is that tumors are not uniform. They often contain diverse populations of cells, and some of which are not affected by the drugs that we use for them. And third is even precise drugs can actually cause off-target effects. And finally, the problem that we have is that these therapies are often very, expensive, and they have very limiting access in many parts of the world. Well, looking ahead, there are reasons for optimism. Artificial intelligence, is being used to design new drugs, which is more faster and more accurately. CRISPR continues to evolve with newer tools like base editing and prime editing, showing more precision. And also combination therapy, which is using multiple drugs to prevent resistance, are gaining momentum. With more comprehensive genomic profiling, we're moving closer to true personalization in cancer treatment. To conclude, targeted therapy has transformed the treatment landscape for many cancers. But to fully realize the potential of these treatment, we must overcome resistance and reduce cost, and to ensure broader access. The future of precision oncology will depend not only on scientific progress, but also on collaboration across research, clinical practice, and regulatory policy. Thank you for your attention.